it's a point called yin tang. It's located straight in the middle of your inner eyebrows. So just over here. The best thing to do it, please place your thumb as flat as you can and cover this point. If you can, with the tip of your thumb, just touch gently the root of the nose, and then you can't miss the point. Relax, rest your fingers, and then you can gently start rotating the thumb. If child allows you, please continue with this motion for around a minute. This point can be quite sensitive in children, so you can gently hold the head if you want to. Again, place the thumb and then rotate. You can talk to your child while you do this. If children are hyperactive, the rule is to go clockwise, as shown. If children are hypoactive, then you might want to choose to go the other way. Now we're going to show you different techniques how to execute the treatment. Most probably, and not many children will actually lay down and let you do everything from step 1 to 28. Children try to mingle, to move, feel a bit uncomfortable. Sometimes we don't like to lay on their back, sometimes we don't like to lay on your stomach. So you can actually do most of it this way. You can actually gently hug your child and look. Step number 1. If you don't know the exact location, go back to individual videos. Step number 2, this time instead of thumb, I use my middle fingers. If the child needs a break, I can give him a cuddle, we can talk, we can do. Step number 3, your gallbladder 13. And again, if he needs the break, step number 4. I can do the interstep now with my 4 fingers all the way down the middle. I can do step number 5 on the top of the head. The other variation, you can actually approach side face to face. And look, that's your step number 1. Gently hold the neck. Step number 2, this time with 1 finger on. Step number 3, you can press and hold. Step number 4, so I can talk to my child, we can keep an eye contact, we can laugh. Interstep down the middle. Step number 5, top of the head. Behind. Step number 6. Step number 7, grasping the neck. Step number 8, walking around the ears. Just few things to bear in mind. Top of the head, which is the bai hui. Back of the neck, feng fu, where your spine meets the skull. Gallbladder 20 or feng qi. And all of this region on neck, it can be extremely sensitive in children on the spectrum. And very common they are. So if you're going to start the treatment, you might want to do the top of the head of bai hui, and children will react negatively to it because it becomes too sensitive. You might attempt to do feng fu and will try to move away straight on. You might attempt to do feng qi, well, go on the side. You might attempt to grasp the neck, and this will happen. Sometimes. Okay. Face cranial massage in order to hopefully help with the articulation, speech development, and reducing the sensitivity to the noise. We're going to work a lot on the face, and basically, although we have a huge number of acupressure points on your face, on your neck, around your ears, what we're basically doing, we're going to try to relax the trigeminal cranial nerve. Very commonly you see in children that the area around the trigeminal cranial nerve, it's quite stiff. Sometimes there is a small deviation of mouth, so the mouth can go either on one side or on the other, left all right, whatever. So we are going to work a lot to relax the trigeminal cranial nerve, but we'll also add the specific acupressure points which can help all of these issues. The trigeminal, big part of the trigeminal cranial nerve runs on your forehead. It goes underneath your, on the top and underneath of your cheekbones, and it sort of like follows your lower jaw. We'll then specifically add a speech area number 1, which we're going to talk about the location in details later on, and we're going to add speech area number, hearing and speech area number 2. This is regarding to scalp acupuncture.